So it's very exciting that we're reaching 25 years of the organisation's contribution to health guidance in Wales. And we were delighted that our programme director, who's on today, Dr. Andrew Champion, was invited to speak at the NICE conference to share some of the things that we have to celebrate of the 25 years of AWTTC. One of the other things I thought I'd pull out is that we also have priority areas where we really want to concentrate our effort into improving prescribing, and that we use medicines in a way that gets the best outcomes for patients in Wales. And one of the ways that we do this is we share real world examples of initiatives, reviews, or ongoing work that has been carried out in health boards in Wales that have actually led to improvements and optimization in prescribing. So we aim to do this so that we can share good practice, really, and then that other people can take up this work. So I've included some of the update. We tend to sort of have spotlights on areas of good practice, but today I'm just going to go through some of the work in Wales that has resulted in improvements in how antibiotics are being used. So in Enair and Bevin, they've had a number of initiatives that have had an improvement in how the antibiotics that we wish to be used. And we have basically what we're aiming to do is looking at reducing what they call the 4 C's, which is 4 different antibiotics that all begin with C, but I won't list them, but they are more related with Clostridium difficile. So the aim is to reduce the reduction of those, and they've done lots of different things really that's had an impact. So they've made the guidelines available in clinical rooms, on computers. They've put information in packs for locum doctors who come in. They've also looked at the antimicrobial pharmacists in this area have provided sort of headline actions for GP practices to prescribing advisors to help with antibiotic prescribing. And then they've also used some of our databases and the tools that AWTTC have provided to compare really what our position is with antibiotic prescribing in England and Wales, and then using these to focus efforts on where there are individual practices or clusters of practices, and really look at them including antibiotics and these tools in their work plans. They've also used sort of posters, newsletters, and they've also used the messages that come up on the GP's computer to give to reiterate those safety messages and guideline messages that we're using antibiotics according to our guidelines at that point of prescribing. And then other things that they've done is they've actually looked at leadership. They've made sure that there's buy-in from some of the directors. They've made sure that the guidelines are disseminated. And then they've used practices where they've had feedback sessions, either with the clinical director or a medical microbiologist, and really looking at making sure that people are using the guidelines. So that's what they've been doing in some of in Enair and Bevin. CumTAF have also introduced a restrictive guideline, and that's aimed to again reduce these 4 C's, the 4 antibiotics beginning with C. And again, that's been effective, and they found that although antibiotic use has gone up, it's been a more appropriate use of antibiotics. So there's lots of different initiatives happening all over Wales, and really what we're wanting to do is to share with people when they've used tools that we've produced and they've had the impact that we want them to have. So if there's any other of our optimization tools that's of interest to you, we kind of have a spotlight on good practice and aim to share that. So some of the other things that we've been doing is we have joined the Medicines and Medical Devices Access Initiative. So this initiative brings together health service bodies from across all the 4 nations with the united by the goal. The goal is basically about improving patient access to safe, clinically effective and cost-effective healthcare products. And we've also been involved in basically how UK patients are enable to have access to transformative new medicines. And we did discuss this at one of our PAPIGs before, but basically this is about making sure where we have medicines that really transform treatment and that we have them available in the shortest time possible. So there's a new pathway called the Integrated Innovative Licensing and Access Pathway. So we have been involved with that along with NICE, the Scottish Medicines Consortium and the NHS. We've also been involved in an issue which causes, I think, enormous stress for lots of people and for healthcare professionals, which is medicine shortages. And some of you may have been impacted by that. So we have published a patient information leaflet to help with how you manage medicine shortages in Wales. And really, these are just about informing people if there is a shortage, and it gives you, some information on what you can do. And we provided those in a range of formats, including an easy read format. We were delighted to be able to join the Genetic Alliance at the annual reception to celebrate Rare Disease Day and to learn more about the Welsh Rare Disease Action Plan, as well as hearing about the challenges faced by those living with a rare disease. So it was great to be able to be involved in that. We've also done a fair bit of training. So we've had some, our specialists in the Poisons Information Service have done some training, a full day of toxicology training to NHS 111 Wales and also the Welsh Ambulance Service. And also we've talked about our yellow cards previously and how important it is to report adverse drug reactions. So we have returned to both Swansea and Cardiff University, and we've been delivering some interactive workshops with pharmacy students on basically adverse drug reactions and the importance of reporting those. So I'll hand back over to Claire and looking forward to